What are SSRI drugs?
Okay. That's the abbreviation for selective serotonin reuptake pump inhibitors, SSRI.
Whoa, that's a mouthful.
Mouthful. So SSRI is kind of a easy way to explain something that we doctors don't understand.
Great, okay.
So we get this propaganda from the drug industry representatives who come and give us samples and wine and dine us and don't
Do
tell
they
us.
really?
Yeah, that's right.
Okay.
And they don't tell us everything that we should know about using these very dangerous and addicting medications that alter the brain. If I had audiovisual aids here, this is a 3-hour lecture that I'm trying to summarize here. But those are chemical structures, chemical small molecules that are able to get into the brain and into the cerebrospinal fluid, and then they alter what happens at the synapse, which is where everything happens. The connection between two nerves is where these things work. They disable the reuptake pump, which is a pore that sucks for instance, serotonin, in the case of serotonin reuptake pump inhibitors, back in to be recycled. Well, when the drug is in the brain, it prevents the serotonin from being recycled, meaning it's going to deplete it eventually, while it's overstimulating the receiving nerve from this other serotonin nerve. You can see why I could use a diagram here.
Right, but you're getting more serotonin when you take
Only
the drug?
you're getting more serotonin only in the synapse.
Okay.
But because serotonin gets not 100%, but close to 100% recycling, it gets used over and over and over again. When you're on the Prozac or the Zoloft or the Paxil or the Celex or the Luvox, you're not getting that recycling effect. So temporarily, you're getting more serotonin impulses on the receiving nerve. So you feel better for a while, but then because the serotonin gets eventually deficient, and it knocks off some of the receptor sites. Again, this is more easy to understand with the diagram. You're altering the brain at least long term, maybe permanently in some cases, but at least long term. So there are fewer receptor sites. You're getting depleted, running on empty on serotonin, which only comes from food, by the way. The only way to raise serotonin in the brain is to take a nutrient called tryptophan or 5-hydroxytryptophan. There's only 2 ways to actually raise total brain serotonin. The SSRIs only increase it in the synapse level, and that's temporary, with a lot of damage being done. So that's why there's the Prozac poop out concept. All those drugs poop out. They stop working after a month or so. And so then you have to raise the dose. And now you're getting even more aggravation, maybe a little more effect, but again, it's temporary. So,
but isn't that the typical pattern with all drugs, whether they're legal or illegal, that you have to take more to get the effect?
That's right. Yeah, that's true. And that's, they call that tolerance. The psychiatric term is tolerance. It works for a while, and then your body gets tolerant to it, and you lose its effect.
So you develop a tolerance for these drugs.
Yeah, so you have to increase the dose. And then if you try to quit, your brain now is dependent. That's where the dependency term comes. Your brain is dependent on the drug, and now you're going through withdrawal. You're craving, or something's wrong, and the only cure is to take another hit. So if you're a cocaine addict and you run out your supply, you're anxious. You're searching everywhere for a dealer to get some more cocaine, or if it's Ritalin, which is the same as cocaine, molecular structure-wise, you're wanting to get another prescription or go to the street. And if you're a Zoloft user and you run out of your Zoloft, and you're frantic to get another dose because you're withdrawing within a day or 2 or 3 of some of these medications. So yes, they are addicting. Everybody, if they take it for a short time, or if it's a low dose, or you're well nourished perhaps, and not on any other drugs, maybe you can take it for a few weeks or a few months and then quit cold turkey without a lot of withdrawal symptoms. But when you've been on it for a long time, or in high dose, or in multiple medications, it's highly likely that you're going to have terrible withdrawal symptoms that may make it impossible for you to get off, or very difficult to get off without going crazy from the withdrawal. We all know the picture of the heroin addict that they throw in a padded cell, and he just sweats and he vomits and he has pain and he's just miserable. And then he eventually, may get a little bit better, but he probably hasn't. That's not very good treatment. He needs to be slowly withdrawn. He needs to be well nourished. He needs to be hydrated. He needs to have some nutritional help. And yet we despise heroin addicts. You know, we despise codeine addicts, but we don't despise Zoloft addicts or Prozac addicts, do we? Or Ritalin addicts.
It's totally acceptable.
Yeah, it's the legal drugs. My best example, and I could show you the molecular structures of cocaine next to Ritalin, and the brain doesn't tell a difference. There's subtle differences there. One's synthetic and one's natural, but the brain can't tell the difference between the two. Yeah. Cocaine addicts prefer Ritalin if they can get it in a snortable form. It's a longer acting. To get the same high, same quick high as cocaine, can't tell the difference. It lasts longer. So Ritalin is probably more dangerous than cocaine if you take it parenterally. Taking it by mouth, you know, you don't get this sudden high. It doesn't go to the brain fast that way as it was injected or smoked or snorted. But long term, the dangers are probably quite similar. And yet, cocaine, you go to jail if you're on cocaine.
But you can write me a prescription for Zoloft and won't be prosecuted?
Right.
All right. Thank you.
The main kind of antidepressant that is the most popularly prescribed are the SSRIs. And these are medicines that increase serotonin transmission. And when you start to push on the doses of these SSRIs, you start to lose some sort of quintessential feminine things. I mean, first of all, it becomes much harder to climax and it becomes much, much harder to cry. But you also see decreases in empathy, in sensitivity, in passion. The simple way of thinking about an SSRI is that you have two brain cells, and one is a pitcher and one is a catcher. So pitch, catch, pitch, catch. So this nerve cell is throwing serotonin across, and this one is catching it. What the medicines do is they block the recycling back into the pitcher. So, you know, I'm throwing, some of this gets caught, some of it gets dropped, it just doesn't get over there, but I'll suck it back in and try again. So if you block the recycling, more is in the middle to get across. So there's more, you know, the space between the nerve cells is called the synapse. If you block the recycling of the serotonin into the releasing cell, more is available for the catching cell. So it ends up enhancing the transmission. How enhanced serotonergic transmission translates into feeling better and feeling less anxious is much more complicated. But you know, the simplistic way to think about it is that if you have higher levels of serotonin, if your transmission is better, you will be more relaxed and more happy. It's a little easier to smile, it's a little harder to cry. So, you know, I've had patients come to me say, you know, I've tried antidepressants before, but they always made me feel like a zombie, or they didn't make me feel like myself. Or, you know, I had a patient who said, like, I cut my finger and I looked down and I saw that it was bleeding and I saw that it was my blood, but I didn't really feel like connected to my finger or the blood. You know, things like that that are really, really worrisome. Or I've had patients say, you know, I was in the situation where I knew I should be crying and I couldn't cry, and you know, I felt terrible that I couldn't express that emotion to, you know, bond with my friend or something like that. So these antidepressants do scale back a lot of expression of emotion and feeling emotion, even sort of thinking emotional thoughts. If you're terribly depressed and you need antidepressants to get out of bed and function and go to work, I get it. That's one thing. But what I'm worried about is more and more women deciding to go on antidepressants because their friends are doing it, and that's what's, you know, more and more women who are at work are taking these SSRIs so that they can not cry, not get flustered, keep going forward. You know, I think it jibes with this sort of forward momentum agenda that so many of us have, and especially in the workplace. But, you know, I would say at what cost? You know, it is true that SSRIs can help you get ahead, and there have been really interesting animal studies where the primates who were on SSRIs ascended up the dominance hierarchy, and the ones who became dominated over got stressed out and had lower serotonin levels. So there does seem to be some component of serotonin affecting dominance hierarchies and the ability to move ahead or to lean in. So I totally get that there are advantages to being on an SSRI in the workplace, but you're going to miss out on knowing what's right because you feel it, or being hurt by what somebody said and showing them that you're hurt. And so that person can learn that their behavior has emotional consequences for other people. So, and it changes the whole sort of tone of the workplace. There's going to be less accountability and less sort of calling people on their misbehavior if you're not even feeling that anyone misbehaved. When you think about risks, if you're really being thorough, you want to look down both tunnel. If this really works out well, how is that? If this works out badly, how is that? And how would that be for me? And so when you're evaluating risk, you need to be in touch with things like fear or vulnerability or anxiety. So if you're medicating yourself to be invulnerable and to let things sort of flow by you and, oh, it's so fine, it's all good, it's no problem, whatever, you may make decisions that are riskier and feel better about them. There are other antidepressants, like there's an antidepressant called Wellbutrin, which, while the makers of Wellbutrin won't really say what its mechanism of action is, it does seem that it more increases your dopamine. It's not so much of a serotonergic antidepressant, it increases dopamine. And dopamine helps you to be motivated and to have a vector and keep going. And to be pretty headstrong. So again, in that situation, you may make decisions that are potentially disastrous. In the same way that somebody who is sort of hypomanic, if you think about somebody who's manic depressive and they have ups and downs, when they're in this hypomanic up, they get some bad ideas that seem like pretty reasonable ideas to them. Somebody who's in a hypomanic episode may be more promiscuous and make bad choices sexually, spend money that they don't have. There's this overinflated sense of self and invulnerability. And you can see the same thing with somebody who is sort of over-medicated on serotonergic medicines, is damn the torpedoes, full steam ahead. And sometimes those torpedoes are going to get you. So there's quite a few things you can do that aren't prescription medicine. The first thing is to really look at how you're living your life. How much sleep are you getting? What is your diet like? Are you moving your body? Are you getting sunshine? Just sort of, the basic things that we as social primates should be doing, which also includes being social, being interactive and not being isolated and withdrawn. My patients who have sort of gotten off their meds and left me, for the most part, are people who have adopted regular cardio practice, where they're exercising regularly. I think that's really important. The other thing is that you can take herbal medicines. You can take things like St. John's wort or 5-HTP, which is an amino acid.
This is Dr. Peter Breggin, and this is another in my Simple Truths about psychiatry. And the subject today is that psychiatric drugs are much, much more dangerous than you've ever been led to believe by the doctors who are prescribing them. I genuinely believe that if most people knew how dangerous the psychiatric drugs really were, most people would never start on them. And I also believe that if most prescribers had even the faintest idea how dangerous they were, they'd stop prescribing them. Well, how is it that so many people can be ignorant about psychiatric drugs? Well, the truth is because they're all getting their information from the drug companies. I mean, when was the last time you saw a car company leap up to tell people way in advance that they'd had some deaths on the road from their bad brakes? When was the last time the car companies went mea culpa and said, yes, our accelerators are sticking and running people down? Well, I can tell you the drug companies are even worse. They go to all kinds of extremes to avoid letting you know and letting your doctor know how dangerous the drugs are. I know this because I've been a medical expert in dozens of lawsuits against drug companies. I've looked inside drug companies and seen what they're really doing. I was appointed by a court in Indiana to be the scientific expert for over 150 lawsuits against Eli Lilly, suits alleging that the drug Prozac had caused violence, suicide, mayhem, mania, and psychosis. So I know what goes inside. I know as much as anyone about how dangerous the drugs are. So let me just give you a little brief outline of material you can find in the first half of my book, Psychiatric Drug Withdrawal. Obviously, the second half is intended to help you come off psychiatric drugs, because it can be very dangerous to come off drugs. It's dangerous and sometimes more than starting the drugs. Let's take a look at the stimulants that you may be taking as a college student or as a parent that you may be giving to your children. Follow-up studies on people who were started on stimulants as children show that they have shrinkage of brain tissue, measurable on brain scans. They have reduced height and weight. They're being incarcerated more often than other people. They're going to mental hospitals more often. Their suicide rate is increased. Every single one of these facts documented by follow-up studies of what happens to you if you get started on stimulants. And one particularly well-done study, the rate of cocaine abuse is greater when you become a young man or woman if you've been put on stimulants as a child. That's because the stimulant drugs, such as Ritalin and Concerta and Adderall and Dexedrine, they're so similar to cocaine in their effects. All right, let's look at another group, the sedative, sleeping pills that you're taking, like Sonata and Ambien, any one of the prescription sedatives used for sleep. We now got 2 or more good studies showing they shorten lifespan. You can Google them. You can Google practically anything I'm telling you, but you'll get more accurate and direct data from psychiatric drug withdrawal. Now, what about the benzodiazepines, the tranquilizers like Xanax and Valium and Ativan and Klonopin? They're very addictive. You know that people taking Xanax in controlled clinical trials, after a mere 6 weeks, a large percentage can't get off. After a mere 6 weeks, they become addicts to Xanax. Great for the drug business, great for your psychiatrist or prescriber who just wants to write prescriptions. Terrible for you. These drugs now, several studies show, like Xanax and Ativan, they're causing shrinkage of the brain too. Coming off them can be an absolute horror story. It can be harder to get off those drugs than to get off opiates. They leave people who try to come off of them with horrendous insomnia, horrendous anxiety, aches and pains in their body, such pain in their feet that they can't stand up, that it's just too much pain, weird feelings throughout their body, and then the realization as they come off that their minds aren't working as well, that they have memory loss for the past and have more trouble learning. Now, I know this is hard. You know, it's hard for me to even talk about it, but it's really time to face up to just how dangerous these drugs are. So we've looked at the stimulants and the sleeping pills and the benzos. Now the antipsychotic drugs, which are not really antipsychotic drugs, they're just lobotomizing drugs that are being given to some people for sleep, like Seroquel is being given to people for sleep, and Abilify and Latuda and Risperdal and Zyprexa. All of these drugs are very damaging to the brain. They virtually wreck a part of the brain called the basal ganglia. They cause a dreadful disorder, tardive dyskinesia. I've done a whole Simple Truth video about tardive dyskinesia. They're shortening the lifespan. We have evidence that people who are put on a lifetime dose of these antipsychotic drugs for whatever reason, whether it's to help you sleep at night or because that you're hallucinating and have a lot of problems, 20 years shortened lifespan. And we know some of the ways the lifespan's being shortened, because especially these newer antipsychotics, so-called second generation or atypical antipsychotics, they're even worse than the older ones in causing a metabolic syndrome. People get obese, they get diabetes, they get pancreatitis, they get elevated cholesterol, blood pressure is off. And then, since the drugs also cause heart arrhythmias and in combination with other drugs do even more cardiovascular damage, that's one of the ways in which people are having shortened lifespan on these drugs. The mood stabilizers, so-called, which are just flattening, emotionally flattening drugs. Most of them were originally anti-seizure drugs. The one we've studied for the longest time is lithium. If you stay on lithium for a lifetime, like your doctor tells you to, you're at grave risk of severe mental problems in the form of memory difficulties, learning new materials, conducting your affairs like you have your whole life. None of these drugs are good for your brain. All of these drugs are bad for your brain, and it shouldn't be any surprise. These drugs are producing multiple biochemical imbalances in brains that don't have any biochemical imbalance until a physician or prescriber puts you on the drug. Now, please don't just stop taking your drugs, because the ultimate tragedy is that coming off of them can be catastrophic. People can get suicidal, they can get violent. Some of the drugs, you can get seizures. Some of the drugs can drop your blood pressure if you're coming off. So, get good information. I put everything I know about it in psychiatric drug withdrawal. Get good information, get some good clinical supervision, work with your family or friends. The shorter time you're on psychiatric drugs almost certainly means that you'll have a better quality of life.
Most violent outbreaks in recent years have involved guns, and new information indicates there's often another common thread: antidepressants. From Columbine to Aurora, the Naval Yard to Fort Hood, antidepressants have been linked to violence. For decades, psychiatrist Peter Breggin has studied this link.
That these drugs are causing agitation, anxiety, insomnia, hostility, aggression, mania.
Antidepressants work on the brain, thereby altering the way people think.
In addition to driving the person with this amphetamine-like effect, the antidepressants kind of do a bit of a lobotomy. You lose your empathy. You lose your caring.
In his book, Medication Madness, Dr. Breggin cites real-life examples of violence that could be blamed on antidepressants.
Of an engineer who was given Paxil probably to help stop smoking, maybe for some tension, certainly not for any mental disorder. And within a couple of doses, he drowned his 2 children and himself in a tub.
Dr. Breggin says when it comes to emotional problems, counseling is the better treatment, saying antidepressants can make the situation worse, especially in young people.
The child who is already angry and upset and withdrawn starts to feel agitated, anxious. Hostility starts to increase, aggressivity starts to increase. The kid has no idea it's a drug effect. Even if you told him it was a drug effect, he might not believe you. He'd say, no, I'm just angry at my schoolmates. I'm just angry at my mother and father because it feels like it.
The Food and Drug Administration receives some of its highest number of violence reports from people taking antidepressants.
It happens often with a dose change up or down, or starting or stopping a change, because that's what jars the brain the most, is the change.
So while antidepressants are some of the most popular drugs among doctors and their patients, they can sometimes lead to unexpected and even dangerous results.
If using antidepressants like the SSRIs actually worked, like we see with all those happy people in the drug ads, right? Well, then I would use them, right? I wouldn't tell people to change their diet and exercise and change their lifestyle, but they don't work. You see, serotonin deficiency is actually a sign of deeper imbalances. It's a sign of imbalances that are caused by toxins and stress and a toxic diet and too much sugar and vitamin deficiencies and even food allergies. And we don't hear the truth. You know, in the New England Journal of Medicine, a study was published that showed that studies on antidepressants that showed a negative outcome were underreported. In other words, drug companies only publish the studies that show things work and don't publish the studies that show they don't work, which leaves us with the impression that they work. Now, let's look at the studies that show they do work. Well, the studies that show they do work show they work in half the people, half the time, to relieve half the symptoms. Not a very good track record. And the majority of people who do take them have side effects like weight gain and sexual dysfunction. Imagine being fat and asexual. That's enough to make you depressed. And the sad news is that 1 in 10 of you out there actually take one. So what is the right treatment? It's not drugs or psychotherapy. The real question is, why are serotonin levels low in the first place? Right? And it reminds me of Joe, one of my patients, whose chemicals were completely out of balance, and he didn't have a drug deficiency. He was on 4 different psychiatric medications, right? 1 for depression, 1 for anxiety, 1 for sleep, and 1 for adult ADD. He had a typical American diet, you know, bagel and coffee for breakfast, sandwich, chips, and soda for lunch, pasta, carbs, and sweets until he went to bed. And then he piled on top of that 2 glasses of wine, 3 cups of coffee, and too many Diet Colas to count. So what did we do with him? I fixed the 7 keys to an ultra mind. I optimized his nutrition by giving enough B12 and folic acid and chromium and omega-3 fats. I got him off all the junk food that he was on, as well as sugar and coffee and alcohol. And I got rid of hidden food allergens, which we'll talk about later in the program. So what happened to Joe? Well, in 3 months, he was off every single one of his psychiatric medications because he was sleeping well. He wasn't depressed or anxious, and he could focus. When we optimized his nutrition and got his nutrient levels normal, he healed. So change your body, and you will change your mind. It doesn't work the other way around. And it happens not in months or years, but in days or weeks.
Dr. Scott, are there psychological side effects to long-term antidepressant use, like becoming indifferent or apathetic because you can't feel your feelings as much?
Yes, there really are. And in fact, it's the psychological effects that have led to more knowledge about the drug studies that led to the approval of these drugs than anything else. We have what's called the Freedom of Information Act in America.
All right.
As a result of that Freedom of Information Act, whenever we have a lawsuit, we can go and get information that the drug companies do not want us to see. And so as a result of some killings where we had people taking these drugs who had no history of violence, all of a sudden start killing people that they didn't even know, we've had some just real tragedies. A number of these have happened. And it's led to lawsuits that have allowed us to look at the drug studies. It's revealed that, boy, there's a lot going on there that we didn't know about. Absolutely, these drugs can cause suicidal thoughts. For example, the drug companies knew this early on. They knew the agitation that is common with these drugs. They knew that before they were ever approved the first time. And yet, in fact, they try to mask that by giving the the sedatives, the chloral hydrate, to those subjects taking these drugs so commonly. So consequently,
Which calms people down.
it calms people down.
Okay.
So yeah, and of course you still look when you open up the package insert that comes with Zoloft. You find, we know for example that those on Prozac after only 5 to 6 weeks, 10% report having shakiness like this.
Okay.
Zoloft the same kind of way, 11% after 8 weeks like this. And so we know that it's causing a real problem. The concern is what happens after a year or 2 years or 5 years on these drugs. What is happening to the brain? And of course we know there's brain shrinkage. We've done
Really?
experimental research with rats. We can give rats these drugs, these SSRI drugs. We know that it leads to shrinkage. Just like we know that Parkinson's disease leads to shrinkage. Well, guess what Parkinson's does? It causes movement disorders. Guess what we know? That antipsychotics, now we know about antidepressants, the same thing, leads to movement disorders. It all fits together. It's all very reasonable. And yes, it causes what we call a blunting effect.
Blunting, all right.
Sometimes called a frontal lobe syndrome effect.
Okay.
Because
That's real.
yeah, it's real. We have these frontal lobes here, and if you simply blunt them with alcohol, with an antidepressant, then you have that natural instinct not to kill yourself. That's blunted. It's not that it ever gets you over depression, because there's no study that's ever found that, not when you do the right kind of study. That's a fair, honest, double-blind, placebo-controlled study. Never found. But we do know that it causes you to have that natural instinct to preserve your life blunted. And so I think people who have friends on antidepressants or antipsychotics, they've seen this. They've
Yes.
seen their friends with those blunted emotions. They're walking around not quite them.
Okay.
Their emotions are blunted. Sometimes I've had people tell me they felt like they wanted to cry, and yet they weren't able to cry. And so the emotions are blunted. Now, on the other side, we ought to mention
All right.
one of the concerns we should all have, and I have an appendix in my book, America Fooled, that deals with this. Sometimes people withdrawing from drugs abruptly have very severe withdrawal
Yes.
syndromes. And consequently, we need to make sure that folks don't simply stop taking the antidepressants all at once cold turkey without being aware of what the danger is. They need to be watched over closely because reality is some of those folks think of suicide at that point.
Okay.
I've talked to lots of people, so I'm convinced it's probably not, but maybe 10%, maybe 20% who have that severe reaction. But because a lot of
Still a
people
lot
do
of
get
people,
off,
though.
a lot of people get off cold turkey and they don't report this at all. But I've talked to enough people who have had that reaction themselves that I know that it's real. There is a professor at Harvard Medical School who's written a book on how to get off the drug.
A whole
and he
book.
basically, a whole book, he recommends just do it very, very slowly. Break off a little bit more each day until
Wean
you're down.
yourself off.
Wean yourself off the drugs and
Which
make sure
makes
others
sense.
are aware of what you're doing because there is risk there.